Good morning and welcome to Real Women, Real Issues. I'm Ardelle Bradley, and today we're going to talk about some items that women really have a problem with and some don't. I have Dr. Rebecca Williams. She's an OBGYN and she's a specialty in making women feel good. She actually was my doctor at one point in time, but then she shooed me away once I had a high-risk pregnancy. But it was glorious to see her again and to see that she's still out there. She's been noted by Essence Magazine as one of the top OBGYNs in the country. She's also been a woman of excellence as one of the best GYNs in the area. So all of you, welcome and thank you for coming, Rebecca.
Thank you for having me.
Well, I want to talk about, I know some things, first of all, about you. Tell us about you. I know you were in Essence, as one of the best OBGYNs in the country, women of excellence. You've been doing medicine, practicing for over 25 years now?
Yes, I have.
So tell me some more things about you.
Well, I graduated from Howard University. That's where I got my BS degree. And then I went to Boston University School of Medicine and got my medical degree. And at that time, I was married, and our mentor told us to come to Michigan.
And here you are.
That was a prime place to come to practice because we're both from Florida.
Okay.
And
you stayed.
We came in 1975, and except for a stint in the Navy, which I am a Navy veteran. I served in Japan.
Well, thank you.
We have been here ever since.
Wow, congratulations with all of that. I'm gonna just dive right into this. You know, some women of my age or surrounding my age, everyone is different. We go into what we call menopause.
Yes.
What are some things, I know everyone thinks that's a death sentence, that, you know, your life is over, it's changed, you can't have sex as usual like you used to, your personality changes. Give me some truths about that.
Well, it is true that things begin to change. And part of that has to do with your ovaries. The ovaries in a woman produces the hormone, estrogen, progesterone, testosterone. And the ovaries get older and fail. I guess people can say they stop producing the hormone. That period of time, no period for 12 consecutive months, is considered menopause.
Okay.
But the trick is, leading up to that, the perimenopause, women start to have the changes of irregular cycles and a slight decrease in their hormone levels. Okay. And that's when they begin to feel symptoms.
Okay. Now, I've had friends actually that have gotten very sensitive. They say they cry at the drop of a dime, and they had to go and get medicine because they knew just washing the dishes shouldn't make them cry. And then I have some friends that say they don't like having sex anymore. They, you know, twice a month is good for them.
Well, the body holds estrogen receptors.
Okay.
The estrogen receptors are from the hair, the skin, the face, all the way down to the vagina. So if you lose that estrogen hormone, you begin to have some disruption in how you feel. And it's that disruption that gives those symptoms.
Okay.
Yes, it does play a major role in that.
But there are things we can do to change that.
Yes and no for some people. It really comes down to personal choice, quality of life. That's one of the things we try to make clear with women. It's not a necessity that you do anything because this is the natural part of aging. However, if you want better quality of life, then we can talk about all types of little things that can be done that consist of hormonal medication and non-hormonal medication.
Okay, but both work as making you feel better or making your body feel normal again?
Well, some patients get relief from some products, but not from others. Okay. So it becomes an individual problem. And I try to get that across the women that yes, you can get information and listen to your friends and look on the internet, but you have to have a relationship with your doctor and do individual. That just because your friend couldn't take it or your mother couldn't take it, it doesn't mean you can't use something. That goes both ways. Not everyone needs something.
All right, we're going to take a break, but I have a lot of questions I still want to ask you. And we'll be back after we go to Jungle Juice and hear about the benefits of juicing.
Jungle Juice Bar offers a wide range of fresh fruit and vegetable smoothie and raw juice blends made with 100% real juice. At Jungle Juice Bar, you can rest assured that there are no preservatives or additives included in our drinks. Enjoy our unique flavor combinations, along with gluten-free, vegan, and vegetarian options. In celebration of the jungles of the world and as part of our commitment to the environment, we have dedicated some of our drinks to the jungles by giving them names of those famous jungles. Each time someone orders a drink, we are reminded of the life given to us by the jungle. Stop by and enjoy a delicious juice or smoothie today. The Jungle Juice Bar is located on Charlevoix in Grosse Pointe Park.
When you're having a heart attack, this is how it feels to your heart. And if it happens at night or on the weekend, there's only one hospital team standing by on site to save you. Cardio Team 1, only at the DMC.
We're the Cronin Law Firm, bringing more to the table. When we sit down together, we share our expertise. You've got a legal problem, we know you need relief. Advice that you can trust, that's why people come to us. We're the Cronin Law Firm, bringing more to the table.
My friends, I want to introduce you to Samasco Financial. As attorneys, they worked hard to protect clients on a legal basis, only to watch many lose their money in the unpredictable and risky stock market. Samasco Financial has recognized the need for asset protection for our seniors and has introduced investment planning that will grow your nest egg without the risk of loss. To find out more about how Samasco Financial can protect your financial future, call 586-493-9989.
Groundbreaking, life-saving, history-making. The new DMC Heart Hospital, summer 2014. The beat goes on.
Real Women, Real Issues is brought to you by Mike's Fresh Market.
Welcome back to Real Women, Real Issues. I'm Ardelle Bradley, and this morning we're talking to Dr. Rebecca Williams, who's an OBGYN, and we're discussing some issues with menopause. Maybe concerns of you, but we want to make sure that we take care of it and get a remedy to it, and she's helping us with that. A question I wanted to ask, women will often say they've gone through menopause. Is that a true statement?
Not really. What they're mentioning or thinking about, their symptoms may have improved. For a lot of women, the first 5 to 7 years when they become menopausal may give them the worst symptoms. And they are hot, and they're sweating, and they are having night sweats, and they're really irritable. And then they'll kind of go over the hump, and the body will adjust. And they'll say, I went through menopause. But I try to explain that menopause is then forever once you are in menopausal.
Till the end.
Exactly. And some women will improve and feel better, but some women will never improve. And so they'll have the same intense symptoms when they're 60, 70, 80. And people say, yes, I see people in church and they're old and they're still fanning.
Right.
Because some people get better, but some people don't. But they're still all menopausal.
So, okay, to my next question then. So if you start taking either hormones or in having sex when you're in that part, because you make it drier, not lubricate as much, so is that something you're going to have to do forever?
No. The patients that are improving and they're feeling better, we tell them, if you want to see if you can wean off and you don't need anything, then you don't need to take anything. Because I give them the adage, why take 4 aspirins if 2 work, but why take 2 if you don't need any? So we use medication for as long as the patient needs it. If they don't need it, we have them stop. Now, for the patients that continue to be very symptomatic, we leave it to their choice. Quality of life.
It's very important.
If you're that symptomatic, then you should continue to use your medication as long as you need it.
And in a relationship, because I'm sure going through menopause, you change, personality, things, it can be detrimental in a relationship. So as long as you want to keep a healthy, happy relationship, obviously you should stay in tune with your doctor. And
with the vaginal dryness for a lot of women.
Okay.
That does give them a problem
Okay.
with their relationships, because the new old age now is considered 100. And people are healthier, and they're having intimacy and sexual relationships a lot longer. Now, there's a lot of products for men to help them perform. But for women, there's not really an FDA-approved product for libido. We can help with hot flashes, we can help with mood swings, with dryness, but the actual libido, which really is controlled by testosterone, there's not a true FDA-approved testosterone for women. So most of that is off-label use.
But it's not definitely true that if you go through menopause that your libido goes away for a woman.
Most women, but a lot of women lose that libido because the ovary produce that testosterone, a small amount that does help with our libido. And with menopause, you lose not only your estrogen, but your progesterone and that little bit of testosterone. And that little bit can make a huge difference in a lot of women, yes.
Okay. Well, thank you, Dr. Williams, for being here today. We'll have to have you back. This is a topic and a subject that's ongoing, as I'm sure you know.
It would be my pleasure, Ardelle.
And thank you for tuning in. Stay tuned, because we'll be right back with more information on hormones and staying happy going through menopause.
Visit loverslane.com for the boutique store near you.
This is Arthur Bricker of Bricker Tunis Furs in West Bloomfield. We're back with the biggest fur clearance sale in our history. Save 40 to 70% off on women's and men's furs and shearlings. Choose from mink, sheared mink, sable, chinchilla, fox, beaver, and exquisite leathers and shearlings in the latest styles from Europe. Plus, our consignment boutique is full of gorgeous furs priced at a fraction of the original cost. No other furrier in Metro Detroit can match our quality, our selection, or our prices. Celebrating 98 years in business. Call today, 248-855-9200.
Find your path to success at Wayne County Community College District. From high-tech facilities to experienced instructors to a range of programs that give you the skills you need for in-demand jobs. Everything you need to jumpstart a new career or advance your education is at a campus near you. And we're here to support you every step of the way. So why wait? Register today.
Welcome to Orchard Maple Family Dental in West Bloomfield.
I'm Dr. William Woodruff. I practiced dentistry in Metro Detroit for over 40 years, and now my son has joined the practice.
I'm proud to practice dentistry with my father. It's his second-generation family business, which now includes my wife.
Working with my father-in-law and husband is very gratifying. We truly care about our patients.
I was very pleased to see in our vacation pictures that I was smiling and my teeth looked great for the first time.
So many good reasons to come to Orchard Maple Family Dental. Saturday and evening appointments, same-day emergency appointments, Snap-on Smile.
It's been really fun here, and I wish I could come here more often.
New patients, just $85 for exam, x-ray, and cleaning. $100 credit on treatments over $250, easy payment plans, and special in-house financing. Orchard Maple Family Dental in West Bloomfield. Call now, 248-702-5822.
With the award-winning Woodhouse Day Spa in your backyard, why would you go anywhere else? Within minutes, feel relaxed, refreshed, and renewed. Handcrafted spa treatments will nourish your spirit and revive your senses and allow dreams to reawaken. Give the perfect gift this season, the Woodhouse Day Spa gift card. A luxury spa experience awaits you right in your neighborhood.
Visit loverslane.com for the boutique store near you.
Ardelle Bradley's hairstyle provided by Megan Mitchell Hair Salon in Ferndale.
Welcome back to Real Women, Real Issues. I'm Ardelle Bradley, and as you know, this morning we're talking about people going through menopause, hormone therapy, and making everybody feel happy at any age. With me now, I have Dr. Christine Blakeney. She's from the Center for Optimal Health. But first, I want to remind you guys to join us for our first Real Women, Real Issues meetup. It's going to be on April the 25th from 3 to 5 p.m. at the Royal Oak Lovers Lane. So please come out, meet, greet, and have a good time. But welcome, Dr. Blakeney. I want to talk to you and continue our conversation on making women feel good at any age, no matter what they're going through. And from what Dr. Williams said, hormone therapy is a great tool to do that with.
It is.
So explain to us, what do you do at your center?
Well, we do hormone therapy. It's a wellness practice.
Okay.
So a lot of times, women going through menopause is a time for them to think, well, I don't feel as well as I used to, and so we work on everything. Okay. Their diet, their sleep, their emotional work that they're doing, and sometimes, and probably frequently, hormone therapy. We usually use what's called bioidentical hormone therapy.
Oh, now is this given to both men and women?
Yeah.
Now, why would men come for hormone therapy? I mean, when they get to a certain age, do they go through the same symptoms or things that women go through?
There is something, we call it andropause, similar to menopause. Okay. It's a time when a man might feel less energy, less interest in sex, not good sleep, kind of blah, depressed, maybe not able to keep the muscle. And so these are things that we can use for them as part of their wellness practice.
Now that's interesting how it sounds like the same symptoms that women have, but we have a term for ours and it's out in the public and people talk about it. It's not always a good term.
Right.
But for men, it's just, okay, they're tired, that's it.
Yeah, or they, they lost interest in sex, they lost interest in everything.
But I just wonder why they term it for women and make such a big deal of it, but for men, it's just not out there. Because it has a negative word when you say, I'm going through menopause. People don't look like, oh, happy, good for you.
Yeah.
But, there's nothing like that, though they're going through the same symptom as women. That's just interesting to, moreover, to show it's more of a man's world, because they put a negative connotation on it for a woman, but a man's going through the same thing.
Exactly.
So they both come to your office. So say I come to you.
Yeah.
And what would you do? What's a typical first appointment with you?
Well, you and I would sit down for an hour and a half.
Okay.
We would talk about everything, all your symptoms, what you eat, how you sleep, your medical history, the history of your family, what your stress is, if you take any vitamins or minerals, if you have any medicines that you take, if the medicines cause you any side effects that you do or do not like. And we'll get to your menstrual history, your pregnancies, everything, your entire female history.
Wow. So then you take that, and then I'm assuming you don't recommend any type of therapy that particular day. You come back for a second session and then determine at that point in time what's the treatment?
So we begin with what we call an anti-inflammatory diet. Okay. So we start right away so that the patient has something to do while she's waiting for her test to get back.
Okay.
Then we do the test to see what's needed. And meanwhile, the patient's been experiencing a lot of success as she works on her anti-inflammatory diet.
Now, when someone comes to you, if you put them actually on the hormone therapy, is that for life?
No. The hormones are adjusted. Each person has her own or his own amount that's needed. Okay. That may be less or more or different combinations as they proceed. So it's nothing's permanent.
We'll be back to hear more on that. But now we're going to go to Dr. Shauna Ryder-Diggs to hear about the dermatology tip of the week.
We are beautiful in every single way. Yes, words can bring us down.
I'm Dr. Shauna Diggs with your skincare tip of the week. Today, we're going to talk about acne cyst. How to treat a sudden acne flare where you develop cysts around your chin, your mouth, or along your jawline. This commonly occurs under hormonal stresses, if you start a new birth control pill or you change your medications. It can also occur at different times during your life. It can also occur before a stressful event, The most common time people come in for this is before a wedding or a big gala that they have to attend. They'll develop large acne cysts on the chin. So one way is to use a benzoyl peroxide twice a day to treat your cyst. Benzoyl peroxide is very fast, it's effective, it dries them up more quickly, so people find it's very helpful. You can also use retin A products in the same way, or vitamin A creams such as Differin, Adapalene, Ziana, Atrilin. All of those can also help dry up a cyst more quickly, so it'll last 2 or 3 days instead of 5 or 7 days. Lastly, we can inject a cyst with cortisone. So it's using a very mild cortisone that's anti-inflammatory, and we can inject it right into the cyst, and usually it goes away within a day or 2. If you give us a call and come in within a day of it coming up on your skin, it can usually go down very, very quickly. So many times prior to a big event such as a wedding, we'll have people schedule an appointment 7 days before, 5 days before, 3 days before, so that we have the appointment ready and they can come in for an injection if they need it. I'm Dr. Shauna Diggs with your Skincare Tip of the Week.
To learn more about Cosmetic Derm and their revolutionary skincare products and services, please visit drshaunadiggs.com.
Mike's Fresh Market, Detroit's largest independent supermarket with the best prices, quality, and service. Enjoy our vast selection of fresh fruits and vegetables. Wide aisles lead you to our own in-house bakery and deli. Beef, pork, chicken, seafood, and much more. You can rest assured you will feed your family the freshest food in town. Whatever you need, you can find it here at Mike's Fresh Market. Mike's Fresh Market with 2 locations, Gratiot and 7 Mile and Livernois and 7 Mile. Better food, better prices. That's Mike's promise.
With the award-winning Woodhouse Day Spa in your backyard, why would you go anywhere else? Within minutes, feel relaxed, refreshed, and renewed. Handcrafted spa treatments will nourish your spirit and revive your senses and allow dreams to reawaken. Give the perfect gift this season, the Woodhouse Day Spa gift card. A luxury spa experience awaits you right in your neighborhood.
When you're having a heart attack, this is how it feels to your heart. And if it happens at night or on the weekend, there's only one hospital team standing by on site to save you. Cardio Team 1, only at the DMC.
Find your path to success at Wayne County Community College District. From high-tech facilities to experienced instructors to a range of programs that give you the skills you need for in-demand jobs. Everything you need to jumpstart a new career or advance your education is at a campus near you. And we're here to support you every step of the way. So why wait? Register today.
Welcome to Orchard Maple Family Dental in West Bloomfield.
Dentists here are professional, the staff is professional, they treat you right, they know what they're doing, in and out, it's what I needed.
The staff has been friendly and very helpful.
You do good work, you train your family, your son, your daughter-in-law to do good work. I am satisfied. I would say to anyone, this is the place to be.
New patients get $100 off any dental treatment over $250. Call 248-702-5822.
Here at Quicken Loans, we take special pride in servicing clients that serve our country.
My name is Marjorie Reyes. I'm a Chief Warrant Officer. I am very grateful and appreciative that Quicken Loans can offer service members VA loans. It was very important for me to be able to close and refinance my home quickly. I wanted to lower my mortgage payment. Quicken Loans guided me through every step of the process. The whole experience was amazing.
Serving those who serve us all. One more way, Quicken Loans is engineered to amaze.
The Detroit Seafood Market is a proud sponsor of Real Women, Real Issues.
Welcome back to Real Women, Real Issues. I'm Ardelle Bradley, and today we're talking about hormone therapy, going through menopause, and making everyone feel good at any age, no matter what you're going through. I have with me Dr. Christine Blakeney, and she is going to talk more about the hormone therapy. I want to just dive right in. I know I asked a question during the break. We were talking about hormone being into people who are athletes. They want to have hormone injections to make them bigger, faster, better, and it has a negative connotation. They say the side effects are bad. And then when you're a woman or a man, as you get older in life and you want the hormone therapy to make your life richer and better and more like normal, what's the difference? Is it still harmful to your body when you take it because you want it as a replacement as you get older, or the same as an athlete when they want it to perform better?
Well, one of the main differences is the dose. Okay. So in the case of an athlete who's using testosterone injections or EPO injections or whatever injections, those are not needed for normal balance of the body. So then in menopause or andropause or other hormone dysfunctions like PMS, et cetera, where we know that the hormones aren't balanced, what we give is the physiologic dose, not a super dose.
That makes the difference.
Yeah, and when. And so in certain women, the dose would only be needed at a certain time of the month, and so that's it.
And then you can level people off of that at any point, or do they stay on it for life?
It can go either way. Okay. So usually people will gradually reduce their hormone therapy when they feel that it's time to do so, and I'll help them do that.
Okay. And I want to ask a question as far as couples.
Yes.
As we discussed briefly, as you get older, women may experience dryness and their desire to have sex may not be there. So they come and they are married or have significant others, and obviously there may be issues or problems static within their relationship due to this. Do you have any testimonies or people who have come back and told you after going through hormone therapy that things have changed?
You know, I always want to find out what the marriage thing is. In other words, it won't do the woman any good to have a lot of interest if her husband is not. So we want to kind of match everybody so that everybody's on the same wavelength. So yes, but in the older patients, for instance, my age group, we probably would need to give hormones to both the male and the female.
Okay.
Just because stress eats up our hormones over our life, pretty soon we're
and
running
we want
low.
everybody on the same page.
Yes, we do.
So you will see couples, they'll come in together and have you test both of them and get them both on the same track.
Yes, and that's a very good thing for them, because if there's another person in the room, it's not so personal and
fight one against the other.
Yeah. So yeah, it's a very good way to do it.
So you have helped couples stay together.
That's right.
Thank you again for being with me this morning.
You're welcome.
And I appreciate all of this wonderful information, so now everyone, no matter what age, can be healthy and happy in bedroom and every other room. And thank you for tuning in this week. And now that you have all your hormone treatments and you're ready to get happy in the bedroom, join us for the meet and greet at Lover's Lane on April the 25th from 3 to 5 in Royal Oak location. I look forward to seeing you there. But also tune in next week for Real Women, Real Issues.